welcome back to the Weekly Wink. Last week we talked about something kind of funny and ridiculous, but does affect a lot of women. We talked about autoimmune diseases. Today we're going to get a little more serious and talk about osteoporosis. And as you can see, my co-host today is Dr. Cantrell. And Dr. Wade and I realized last week that after doing almost 50 of these, we never actually introduce ourselves. So I'm Dr. Murphy, and we are part of Elements Natural Medicine, bringing you this Weekly Wink every week, trying to give you just tiny little nuggets to help you understand how your body's working and give you little tricks and things you can do to feel better really easily. All right.
So today we're going to talk about bone health, hence the title, Know Your Bones. This is something that I probably see a little bit more here in the clinic, dealing with bone loss and possible osteoporosis. So there's two different types of bone loss that that a person can display, and it depends on the degree of bone loss that you have as to how you're classified. So we have osteopenia, which is anywhere from, when compared to the average 30-year-old woman, osteopenia is anywhere from 10 to 24% bone loss. Osteoporosis, which is what is medically treated, is anything 25% above bone loss. That's actually a significant amount of bone loss if you think about it. So there's things that can increase your risk of losing bone, especially being in that osteopenia state. And one of those is taking certain medications that can increase that. So one thing that we see quite often are patients who are on medications for, I'm going to let you sneak back in, we'll just switch places.
Little tech issue there.
Medications for heartburn and reflux. So taking those medications can actually increase your risk of developing bone loss, because your body needs needs acid to absorb calcium. So if you're taking things that decrease the acid in your stomach, then you're going to also decrease your absorption of calcium as well. Other things, genetics can certainly increase your risk of losing bone density prematurely. Not getting enough nutrition or calcium during bone growing ages, your teen years and early adulthood. So all those can lead to osteopenia or osteoporosis. Now, how do you know if you have it? There's actually a really easy way to test for it, and the most common way that we test for it is through what's called a DEXA scan, or a DXA. Most often it's done centrally located, and what that means, and it's referred to as a central DEXA, and what that means is that a central DEXA is actually looking at bone loss in your spine and your pelvis, or specifically your hips. So there's other ways to do DEXAs. You can do peripheral DEXAs if a patient is unable to do a scan of their spine and hips. You can do measurements on the forearm, you can do it on the heel, the wrist. So there's other methods to assess bone loss, but central DEXA is the most common.
Now, the DEXA is really just detecting how much bone density you have, and they compare it back to the average bone density of somebody of your race at 30 years old. So they're looking at kind of the statistical average of how strong your bones would have been compared to where they are now. And it's really important to know, because if you are having significant bone loss, we want to really get aggressive about treating it. But we don't start DEXA scans typically until about 65 years of age, at which point, there's not as much that you can do. Even earlier DEXA scans for people of high risk are not going to start until maybe 45, 50. So there are some functional medicine tests where we can look at bone turnover. Your bone is constantly being broken down and built back up. And one of the things with osteoporosis is the breakdown happens more quickly than the rebuild. And so there are some measures of turnover that can be really useful if you're at risk, or if you want to get aggressive early, so you don't have to get as aggressive and do so many changes. And they have crazy names like NTX and CTX and PINP, and there are quite a few other markers, but really just simple either blood or urine markers. And even yours really standard comprehensive metabolic panel, which your doctor's running probably every single year, has a couple markers that will give us some really early indicators, like your calcium level and then your alkaline phosphatase. Those are both markers of how your bone's breaking down, as well as how it's building back up, or do you have what you need to build it back up. In addition to that, vitamin D, which Dr. Cantrell is going to talk about more a little bit later, is a really critical cofactor in giving you those strong bones to begin with.
So we're going to talk about some of the things that can help you maintain your bone density or even improve bone density. So the standard medication is actually not intended to improve bone density, because the most medical societies and actually the National Institute of Osteoporosis or National Osteoporosis Foundation actually says there's no cure for osteoporosis. So that's the traditionally accepted outcome for this condition. But there are ways that you can maintain the bone that you have right now, so prevent further loss. But then I have actually seen changes in DEXA scans with doing lifestyle changes and also supplemental changes and changing diet as well. So Dr. Murphy is going to talk about some of the dietary changes that you can make, and then I'll touch on some of the supplements.
So you may have heard of the alkaline acid diet or hear that foods are too acidic for your body, and you might not really know what that means, especially when lemon juice is termed alkaline, even though it's obviously an acid. What we're really talking about when we're looking at alkaline acid balanced diets is not is the food acid or basic in its own right, but what does your body have to do to maintain this really, really tight pH range that we keep our blood in? pH is a really quick chemistry 101, is a measure of either acidity or basicity. Water has a pH of 7, which is dead neutral. You're not going to burn yourself with water. You're not going to bleach your clothes with water. Our blood tends to stay 7.3, 7.4, so slightly basic, slightly more bleach-like, just barely bleach-like compared to neutral. We need to keep our blood there for all of our proteins to work well. So if we eat a lot of foods that are super acidic, which is your sodas, your caffeine-based drinks like coffee and tea, even alcohol, lots of red meat, all of those foods provide a lot of acid in their own right, which means we have to buffer that. We have to add in base to keep our pH at that nice, almost neutral level. Where that base comes a lot of times from our bones. Think about when you have acid reflux, what's an easy thing to grab? Tums. Tums is calcium hydroxide. Well, our bones, or calcium carbonate, sorry, that's what our bones are made up of. So one of the things we can do when our body gets way too acidic and we need to calm it down is basically release some little Tums from our bones, throw out some of that calcium carbonate, and calm down the acid. But what that does is take that density, take that strength out of our bones. So eating a really acid, alkaline balanced diet, meaning much more alkaline than acid, which is your whole fruits and vegetables, lean proteins, more vegetable-based proteins, a limited amount of grains, limited refined sugar, all those things will help put you in a situation where you're not having to pull from your bones to maintain nice, strong bones. And we'll put a link to an acid alkaline basic diet in the comments of this video.
So I'm going to talk about some of the lifestyle factors that you can do to improve bone density and also maintain it. So exercise. Exercise is great for nearly everything, if not everything. But there's specific types of exercise that you want to do. And the two different types are weight bearing and also resistance exercises. So weight bearing basically means you're doing activity where gravity is having an effect on your body. So it's pushing against your body. And so weight bearing exercises would be things like walking, jogging, playing tennis,
lifting weights.
Even golfing would be a weight-bearing exercise because you're moving and you're supporting your body's own weight. So while bicycling and swimming are great exercises and great for cardiovascular health, they're not that great for improving bone density. So those weight-bearing exercises are very vital to keeping your bones strong. The other type of exercise, strength training, you mentioned lifting weights, so that's very important. So anytime that you're putting resistance against that, on that muscle, it's pulling on that bone. And when it pulls on the bone, say I'm doing a bicep curl, it's going to pull on this bone right here where that muscle's attached, and it's going to create a little bit of stress there. So sometimes stress makes us stronger, and that holds true for our bones. So when there's stress on that bone, that density is going to increase and it's going to make the bone stronger.
Now, we talked about, those are always to maintain your bone strength. Like Dr. Cantrell said, even though the conventional wisdom is that you can actually increase bone density, that is not true. There are a few things that have been proven to actually increase or help you return some of your bone density back and strength back into your bones. One of those, interestingly, is yoga. A very specific type of yoga, a very specific run of moves has been shown recently to improve bone density. It's Dr. Fishman is the doctor who developed and studied the yoga exercise. It's nothing crazy. It's not as if you have to be able to do a full scorpion. It's really some fairly basic yoga moves, just done in a very precise posture to really put weight-bearing exercise on your hips, on your shoulders, on those joints we know tend to be most at risk if you do have osteoporosis. I'm sure you know somebody, a woman who is older who has broken a hip because of osteoporosis. We want to get those hips nice and strong. Now, interestingly, the study showed not only did people increase their bone density, they actually were able to increase their bone resiliency as well. And that's not something that's picked up on the DEXA scan, but basically it means that our bones have a certain amount of flexibility to them, just like trees do. You know, you think of an oak tree being big and strong, but it also has enough flexibility that can handle high winds. Well, we want our bones to have that same amount of flexibility. So the yoga will do that. And we're going to put quite a few links with this video because we want you to have some really good actionable items. I'm going to put a link to the YouTube video that takes you through the set of 12 yoga exercises. You can do them in 12 minutes once you know what to do. And actually one of our local yoga studios is doing a training starting next week that will take you through for 6 weeks how to do all those moves exactly. Now, the study had people do them every day or every other day, and just that 12 minutes 4 to 7 times a week had a significant improvement, which we don't even expect to see with bone density in a group of women who had osteoporosis or osteopenia.
So another thing that yoga can be very beneficial for, and we often overlook, is the importance of balance. So balance is essential for not only just overall well-being, but also preventing falls, because that's the biggest concern when you have osteoporosis, is that you fall and you break a hip or you break an arm or whatever the case might be. So working on balance is vital, is a vital part of an osteoporosis prevention and also treatment plan. So I'm going to talk about some of the supplements. So just quickly, calcium, we already mentioned calcium. So making sure that you're getting a good source of calcium. So if you're over the age of 50, a woman over the age of 50, you should be getting 1,200 milligrams of calcium a day. That's combined from diet and supplements. If you're under the age of 50, female, you should be getting at least 1,000 milligrams. Now, men, the age is a little bit higher. So if you're a man and you're age 70 and over, then you want to be getting 71 and over, it's 1,200 milligrams of calcium a day. Again, combined diet and supplement support. So it's pretty hard to get 1,000, 1,200 milligrams from diet alone. I guess consider that 8 ounces of collard greens contain, I think, around 300 milligrams of calcium, which is actually pretty high because we think of dairy as being the only source, but that's one of the highest sources of calcium. And so making sure that you're getting adequate calcium. Another important thing when you're taking calcium-based supplements, is that you do it in small amounts. So your body is only really able to handle or absorb a certain amount at each time. And so it's actually recommended to take no more than 500 to 600 milligrams at a single time. So calcium is best absorbed when you do it in small increments throughout a day. Same thing with dietary sources, small amounts, multiple times a day. Now, vitamin D, this is often overlooked. Actually, it's becoming a little bit more recognized. And if you recall back probably a few months ago while Dr. Murphy was away, I did a vitamin D wink with Dr. Wade. And so we talked about all the benefits of vitamin D, but essentially what vitamin D does is, and how it's important for bone protection and bone loss and bone density increasing, is it actually helps your body absorb calcium. So I used this analogy before in the previous episode, where vitamin D is like the key that unlocks the door that allows calcium to be absorbed into your body. So you have to have vitamin D on board. Minimum recommended amount is 2,000 units a day. Best sources for that include sunlight is actually the best source. So making sure you're getting at least 10 minutes of direct sunlight on your skin every day. You want to make sure that you're getting that, and dietary sources. Actually, like I said, the best source is from sunlight. So we actually have a formulation here that we use quite a bit. It's called NBI Osteo-K. It was formulated by 2 different physicians and 1 biochemist. And they have actually seen increases in bone mineral density with this particular formulation. So it contains that calcium, that vitamin D, but it also contains another often overlooked vitamin, and that's vitamin K2. Now specifically, it's the type of K2 is called MK4. So that has some pretty significant, incredible research behind it in terms of improving bone mineral density.
All right, so in a wink, with osteoporosis, we want to keep our bones as strong as possible. So make sure you're getting your vitamin D, your calcium, and your sunlight to really naturally get those minerals in so you have what you need to build your bones. Make sure you're doing some weight-bearing exercise. Like Dr. Cantrell said, that can be a wide variety of things: running, walking, hanging out with your kids, your grandkids, and running around. Also make sure you're doing some resistance training. And then flexibility and balance are super critical. So you always want to do that combination of weight, flexibility, and balance. And if you do that nice mix of 12 minutes of yoga at least 4 times a week, as well as 150 minutes of some sort of cardio, you're really going to cover that in most situations. So 3 simple things: get your minerals that you need, move like you need to move, and make sure you have good flexibility. Now, one quick thing that has nothing to do with osteoporosis, but something to do with some fun. We're about to order new t-shirts, and we have a poll going on right now. You guys get to choose which quotes are going to go on our new t-shirts. So since you're on Facebook Live anyway, hop up to the top of our Facebook page, click on that poll. It'll only take you a couple minutes, if that. Choose your favorite quote and move on about your day, and just keep an eye out for when we're doing our t-shirt order. All right, next week we have a fun weekly wink. It is Naturopathic Medicine Week coming up, and so we are going to talk all about who we are and what we do in the big picture, and give you lots of fun little tricks. Give us a little bit of our history, how we ended up being naturopaths, and what we like to do in the clinic on a regular basis. All right, see you next time. Bye-bye.